We are live.
A very good evening to all the viewers of this podcast. We call this podcast by name Gyan Pravah. ज्ञान का बहता अनोखा रोज एक नया रंग हर रात आप जुड़िए फॉक्सी के संग at 8 p.m. Thank you so much for joining, and I extend a very warm and very heartfelt welcome to Vice President Foxy, Dr. Palani Appan sir, and a guest today, Onco Robotic surgeon, Dr. Abhinav Deshpande from Nagpur. It's a great honor to have both of you today with us.
Thank you.
So this podcast, Gyan Pravah, is an idea conceived by and is a brainchild of our beloved, lovely Foxy President, Dr. Sunita Tandulwadkar, Madam. Madam is an graceful epitome of dedication, determination, discipline, and most important, multitasking. It's only 100 days, that is only 3 months into her leadership, and we have almost reached 300, or we are reaching 300 society through the CMEs, more than 30 publications, more than 30 great projects, and a very deep dive into the spirituality, which she is blending with public awareness, creating a very huge and a massive public awareness program across the country, across the all OBGYN societies, binding the societies from Kashmir to Kanyakumari and bonding the societies with one single mission, Har Ghar Foxian. Dr. Sunita Madam, we are in awe of you. And with to her team is the most acclaimed, very appreciated all over India. Today we have with us Vice President Foxy, Dr. Palani Appan sir. It's a great honor for us, sir, today to have you with us. We welcome you. As we all know, Dr. Palaniappan sir is a very highly acclaimed academician, is the Vice President Foxy. He has been the president of Southern Indian Societies of OBGYN, and also he is the recipient of prestigious Kamini Rao Yuva Oration, Indumati Javeri Prize, Young Scientist Award, and he has received traveling fellowships all over. It's a great honor to have you, sir. Sir, we would like to invite you for your introductory remarks for this podcast.
Thank you, Dr. Rashmi. And as you said, it's been a fantastic journey the last 100 plus number of days after having taken over as Vice President of Foxy with Dr. Sunita as the President. And what is very impressive is in these 100 days, 100 opportunities have been given to hundreds of people. And it's been a fantastic journey. And Foxy is doing extremely great under the leadership of Dr. Sunita. And this podcast series has been something which has been very close to the heart of Dr. Sunita and to us, me, and a lot of us across the country, because every day, 8 o'clock sharp in the evening, whether we eat, whether we do a surgery, whether we go home, whether we return back from work or whatever, the podcast series has been doing wonderful. And we all get that, that click in the mind at 7:55 and say, oh, we have the Foxy podcast today. And it's done by chairpersons every day at 8 o'clock, 8 p.m. Dr. Sunita comes here at 8 for whatever reason. And it's been an absolute dedication and commitment from the entire Foxy team to have a podcast at 8 o'clock every day. And coming to the people who have been interviewed by the chairpersons, it's been absolute dignitaries, young, middle-aged, and of course, experienced people who have been coming on to this podcast, sharing their academic deliberations, not only academic, whether it be their political background or non-academic background. They've been doing absolutely fantastic. And this podcast is something which has been very, very lovely and lively for the entire Foxians in the country. And we're looking forward with Dr. Abhinesh. Absolutely welcome to this particular event of podcast, Dr. Rashmi Kagar, who's been doing a wonderful job. Apart from the podcast, Dr. Rashmi is the chairperson with me under my committee, and I know the dedication that Dr. Rashmi works with, and me and Rashmi have been associated with the perinatal mental health work, which we do a couple of modules across the country. It has been an absolute success. And so it's been fantastic working with you, Rashmi, as well. And all the very best to this podcast series without wasting much time between me and the guest speaker of the podcast. I hand over to you, Rashmi. Absolute honor and privilege and pleasure to be here. I'm stumped by the way you're going on and with a very young onco surgeon who's going to speak to us on his academic deliberations. And thank you very much for having me with you on this podcast. It's an absolute honor. Over to you, and thank you very much.
Thank you so much, sir. You are the strongest pillar of team of Dr. Sunita, madam, as we all know. And it's a great honor for me that I'm associated with you as a chairperson, and my respective vice president is you. And that's itself is a great honor for me, sir. Thank you so much. Thank you so much, sir. And it's a great honor for me to introduce Dr. Abhinav Deshpande to the house today. Dr. Abhinav Deshpande from Nagpur. He is the director of surgical oncology and he's a robotic oncosurgeon. And he is currently working at Max Super Specialty Hospital at Nagpur. He's a fellow of American College of Surgeons. And his areas of expertise are robotic and minimal access oncosurgery. He is expert in breast oncosurgery and oncoplasty, fluorescence-based oncosurgery, including sentinel lymph node surgeries, GI oncosurgeries, head and neck oncosurgery, thoracic oncosurgery, and most important, peritoneal surface malignancies is expert in dealing, and also HIPEC and PIPEC specialist he is, which we will be knowing much more about it in our during our talks. And he has won People Choice Awards for research work on robotic port replacement at Memorial Sloan Kettering Cancer Hospital Center, New York. And he's also selected for travel fellowships and presentations at various conferences held at Amsterdam, Netherlands, Portugal, San Francisco, New York, and Korea. He has won Best Paper and Video Presentation Award at All India Robotic Surgeon Conference held at Missouri 2028. It's a great honor, Dr. Abhinav, to have with you us, and we are looking forward to know more about your work and more about your dedicated surgeries, how you handle the malignant patients, etc. in our podcast. Welcome to the board.
Thank you so much, Rashmi ma'am. It is a great honor and pleasure for me to be invited on this august platform of Fogsi. My deep regards to Tandulwadkar madam for this great initiative and Professor Palani Appan sir. Thank you so much for this warm invitation today for the podcast.
Welcome, Abhinav. So, Abhinav, I would like to start by asking you something. Like when I was actually reading all your CVs, it's huge CV, it's great work. Actually, I really had to, even now, I have to actually read from the CV. And while I was dealing with your work, I read an Hippocrates one saying he said that healing is a matter of time. He says healing is a matter of time, but sometimes it is also a matter of opportunities. And opportunities what? The opportunities to heal the diseases, especially these are opportunities created by doctors, especially those diseases like cancer, which demands even something more than healing. And you are one of those doctors who are dealing and you are creating these opportunities for cancer patients. So I would like to know the first thing, what made you select this particular stream for your super specialization?
Thank you, ma'am. Yeah, it is a very interesting question as to what made me select. Like every child learns everything right from the beginning from his parents. His parents are his first teachers. I do continue learning from my parents, and in fact, they have been the pillars for me becoming a oncosurgeon. My father is a general surgeon, and I was awestruck right from the beginning, right from my childhood. The way he carries his aura, the way he deals with his patients, and I was very sure that I have to take up surgery as my profession, as my career choice, and it was always my best career choice. Uh, so I was fortunate enough to become a surgeon, and then coming to oncosurgery, the second part of it, it is all dedicated to my mother. We had one unfortunate tragic event in our family, medical related issue. My mother, she herself is a practicing anesthesiologist diagnosed with malignancy, That time I was doing my masters in KEM Hospital, Mumbai. It was a very tumultuous time for me, undoubtedly. But I think some or the other way that clicked some strings in my heart that I need to kind of pursue Onco as my career option, basically. And I had a lot of inquisitiveness about Onco. See, since we as a family were suffering from the drastic effects of Onco, so I think over a period of time that carved a way for me to become an oncosurgeon. So I would, in fact, dedicate my career to my both my parents, my father and my mother, for making me a surgeon first and then an oncosurgeon.
That's such a nice thing to know. And so you have mastered onco, you have chosen onco surgery, but now you are a very fast emerging robotic surgeon. So how you diverted towards robotics actually?
Ma'am, so as all of us get inquisitive about this word robotics, when I was doing my masters in back in 2011, 12, 13, so that time also I came across this word of robotic surgery. It all created a lot of inquisitiveness in my mind as to how robotics would be applicable in terms of surgery as a branch. uh, that time slowly robotics had started finding its ramifications into our clinical practices as well, like in general surgery, in OBGY, in most of the branches it had slowly started finding its way. So obviously it created a lot of stir and buzz in my mind as to I would also like to explore this new technicality towards our conventional gold standard surgeries. And as it is, I was obviously very interested in surgery per se as a branch right from my childhood. I wanted to take it one step further as to explore what exactly would be a man machine interaction look like. So that is how that basic interest stemmed right during my MS time. And I was inquisitive in kind of pursuing more for this branch, which was robotic surgery. So that is how it created a interest in my mind and I decided to pursue it.
And now you are the masters in that. You have made your own signature in this type. And I think you are most happy doing robotics, right? Yes. So now this is your branch of choice, actually. So this is something we call God's own plan, and I must say that because now you have carved your own status, uh, you have carved a niche in robotics. You must have faced lots of difficulties because this is comparatively new branch and not many people are doing it. So, of course, we have people doing it, but the number is very few. So, this is something we say a start or something new. And when we are going to do something new, we are going to face difficulties. You must also have faced difficulties. Would like to know your journey regarding the same.
Yes, ma'am. So, as you very rightly pointed out, God's own will. I do believe in that concept. I do believe that some or the other way, all the dots ultimately get connected. That is how I would like to put it across. Um, I did have interest in robotic surgery per se, but I never imagined that it would come to me in such a way that I was getting a fellowship, entire 1 year fellowship in robotic surgery seat in Bangalore. So there have been tremendously difficult times. At times, very depressing. All of us, in fact, all the doctors, they do pass through that journey. Everybody has to go through that. Unless and until there is a grind, we would not actually enjoy our profession to that great extent. So there have been times which have been extremely depressing. There have been times wherein you feel as if whether you have taken a right decision or not. You start doubting your own self. So yes, there have been a couple of times wherein the situations were really tough. But I was always inspired by this very saying that when the going gets tough, the tough gets going. So I think the most important aspect is to just keep a focus on what you exactly desire and what you exactly believe. You kind of do your best and ultimately leave it to God, uh, because God has His own will. That is how I would like to put it across. That there have been times that things were not going great, and one has introspective doubts as to whether you have taken a right choice or whether you have taken a right branch. Robotic surgery also, or onco surgery also, has not come up that easily. Obviously, it has been through a very tough journey. It has been a tough journey, and there have been a lot of ups and downs. But eventually, as I mentioned, that the only thing which kind of keeps us going is faith and focus. That is what I would kind of put it across. That everybody has their share of joys and sorrows and tough times, and I also do share those same emotions.
How they say, when the going gets tough,
Yes,
the
yes,
tough
yes,
gets
yes.
going.
There have been really tough times, and it is not an
And
easy journey at all.
and also there is role of teachers and guides.
Absolutely, ma'am.
Like Guru bin Gyan kahan se paaye, and unless and until they guide us perfectly on our way, and things won't happen. So
Absolutely, madam.
so
Guru
there
Brahma,
must have
Guru
been a
Vishnu,
role of
Guru Mahesh.
guides and teachers also.
Absolutely, ma'am. So teachers undoubtedly, they, in fact, they show you the light as to how, where exactly you have to travel. They carve the path for you. And as I mentioned initially, that the parents are the first teachers for us, but ultimately your mentors, your professional teachers, your guides, they also kind of have a tremendous role in shaping up your own career. So I do believe that that is a the teachers have lion's share in anybody's career.
So you are, Abhinav, you are basically treating 24 by 7 cancer patients. You are continuously dealing with them. See, as an OBGYN also, as an association also, I would like to say that we are doing a lot of work in prevention of cancers. We are creating awareness programs, we are doing awareness drives, we are doing screening programs, we are trying to help and reach to the women of India with this mission that there should be prevention, early detection. But sometimes we feel that the situations are really gloomy. Even after doing so much work, we come to face those patients who present to us with the late stages of cancers. So it sometimes it really hampers the morals we are doing, and it questions us if we are doing enough for prevention or early detection of cancers. You must be facing patients, this type of patients regularly. So, as an oncosurgeon, what you would like to say when still we are getting late stage cancer patients presenting for the first time in OPD?
Yes, ma'am. Unfortunately, that is a practical problem which all of us have to face. No matter whatever best all of us are trying to spread the word, to spread the awareness, but still there have been times, and there are cases who come to us in very advanced stages. There are a lot of myths which are associated with cancer, specifically in cases of breast cancer patients, that a biopsy would be detrimental at the initial stages, and a biopsy would lead to spread of the tumor. So many a times females are not wanting to get a biopsy done, not wanting to prove the diagnosis. So that is, unfortunately, there are some myths which definitely need to be busted in India. We do have this practical problem. We do have this scenario wherein the patients are coming to us pretty late for the same reasons, because there are a lot of myths which are going around them. And I must appreciate Foxy for having taking this great initiative of spreading the prevention and awareness program of onco related issues in gynec as well. And maybe all of us, if we collaborate and try to work on grassroots levels, that is how I would like to kind of take it across. That we need to kind of put it across in a very clear manner that cancer needs to be discussed. It cannot be like, especially for females, you cannot shy away from cancer. You cannot consider it as a taboo, that there is a lump in a breast and a female is, because she feels that it is a taboo, and she feels shy to consult. I think all those things have to be taken into consideration. They have to be busted, and we need to spread that awareness that early detection can lead to early treatment as well as a further prevention of the spread of the disease. So, and ma'am, one important point which I would like to highlight in this regard, that it is not only the uneducated class or the people who are staying in the periphery. We are getting patients who are from highly educated background, who are well aware of cancer as a disease, who are well aware about and about their surroundings, who are well aware about these discussions, but some or the other way they are not in a frame of mind to accept, and they are not in a frame of mind to have a discussion around. And we have seen that patients who are coming from even affluent backgrounds, they also turn to us with advanced stage cancers. So I really feel that word needs to be spread across, that we anything that in cases of symptomatology, if we take into consideration, so anything which is unusual, persistent in the body, and which is unexplained for a long period of time, it has to be immediately consulted. And at least one consultation, one investigation can at least kind of clear most of our doubts. So I really feel, and I would encourage on this platform, and I would like to spread it across, that in case if you are having any sort of a symptom of what your body is showing, which is unexplained, persistent, and unusual, please consult. Please consult. That is how I would like to put it across.
Absolutely, very well said. And what I understand that you want to say that we should make a basic change in the mindset of the people regarding the same, so that they come to their clinicians and get examined. So that is very important. So when I was reading your CV, there are some two advanced things like PIPEC and HAPIC. Would you like to say something about what's that new in oncosurgery?
Yes, ma'am. So basically, in oncosurgery, if we consider oncosurgery per se, it has been kind of more than 100 years that oncosurgery has found its firm foothold in terms of surgery. Back from the days of Sir William Halsted, who was the one of the pioneers in setting up radical surgeries. Now we are moving towards more and more minimally invasive techniques as well, and at the same time we are expanding our horizons in terms of uh, aggressiveness of our treatments also, in terms of treating the cancers. That is, many a times what initially was thought to be palliative may now be curative, in fact. So we have to also change our mindsets in those regards, that we can offer whatever best we can offer to the patient according to the current practicing evidence. That is how oncosurgery would be taken to a next step. So, in terms of the recent advances like minimally invasive techniques like robotics has already penetrated oncosurgery. Similarly, fluorescence-based oncosurgery is also starting up. That means like sentinel lymph node biopsies. In terms of endometrial malignancies, to give you an example, there have been enough trials that in early stages of endometrial malignancies, we can inject a dye, something like indocyanine green, and actually trace the lymph nodes in the iliac and obturator region. Send only those nodes for frozen section analysis, and in case if those nodes are negative, we can get away without a morbidity of we can get away with the entire morbidity of lymphadenectomy. So so that is one of the advance, and that is like we are trying to kind of curb the morbidity to the patients, and we need not be very radical always. We can kind of offer the best possible minimum effective treatment as well to the patient. So in the same regard, HIPEC and PIPEC is basically hyperthermic intraperitoneal chemotherapy. So there have been concepts in which a conventional chemotherapy, if the patient is not responding, especially in terms of advanced ovarian cancers. So many a times the blood peritoneal barrier may not be penetrated well by the chemotherapy drugs. Patients may not respond well to IV chemotherapy. So in those cases, nowadays the concept is emerging, that in case even if it is a stage 3C sort of a situation, that means there are deposits inside the abdomen, and we can still take into consideration a complete cytoreduction. That means we can practically remove that entire disease and put in chemotherapy at a heated temperature, that is around 41 to 42 degrees Celsius, and we can expect the chemotherapy drug to enter into the nooks and crevices of the abdominal cavity and kill the tumor cells there, and over a period of time decrease the rates of recurrences and improve the survival of the patient. So that is basically hyperthermic intraperitoneal chemotherapy, that is HIPEC, and PIPEC is pressurized intraperitoneal aerosolized chemotherapy. Now, in certain cases who are not amenable to treatments like cytoreduction and HIPEC, which are curative sort of modalities, in widespread diseases, patients who are having uncontrolled ascites, who are not responding well to chemo. So now the concept is that under pressurized form and in aerosolized manner, you can actually spread chemotherapy drugs inside the peritoneal cavity. It will act locally, and over a period of time the disease would respond. That is the basic concept behind use of PIPEC. So HIPEC, PIPEC, these are also the newer modalities apart from minimally invasive surgeries, which are slowly started finding its great application in terms of a previously doomed cancer patient. So now we are trying to offer that hope, that treatment to the cancer patient through these different modalities.
So it's so really wonderful to know all the advances, and there it sounds that there is hope in the future. More recent advances, more innovations, and more better treatment to the patient. So it's really a very hopeful condition. And while talking about robotics, too much artificial intelligence, Abhinav, what do you think? Are we using human touch? Do you think like that?
So, ma'am, this is a great topic, in fact, to have a discussion on. Artificial intelligence is coming up in a big way, no doubt about it. We are all getting its experience, and sooner or later it is going to penetrate all our branches as well. So I really feel, see, there is a lot of skepticism and apprehension as to how doctors are going to pursue artificial intelligence. But I genuinely believe that if we kind of work in synchrony with artificial intelligence, we try to augment our treatment protocols for the benefit of the patient, and we try to take it more optimistically, I feel it will have tremendous applications. And just to have a thought about it, if we take into consideration something like what is thought beyond human capacity, that might be which is not natural intelligence, right? So if we try to expand it into the horizon that the artificial intelligence might come up with something which we currently cannot think about, like for example, there is a complete cure for HIV, or a complete treatment for, or you can eliminate cancer per se from the human body. So whether there are any genetic modifications, whether there are any specific treatment protocols, or whether there are any specific thing which can come up in that dimension, which we as human beings cannot think about. So that might be the real application of artificial intelligence in our practice. And it may not be only and only related to the physical part of it, that is just interpreting a ECG, just interpreting a X-ray or a CT scan, or performing a procedure, but it can have application way beyond our thought processes as well. So I think with that creates a lot of apprehension in our minds, but at the same time I feel pretty optimistic that in sooner or later times doctors would also be opening up to the world of artificial intelligence, and maybe we would also welcome artificial intelligence which would benefit our patients in the future. So I am optimistic that AI is going to kind of be of benefit to us.
So to be used wisely and have a balance. So that is so important. So one more thing which is coming to my mind across the interview, Dr. Palaniappan sir is also here. So we all the branches we are dealing with stressful situations on daily basis. There is no doubt about it. Maybe an obstetrician, and you may be as an onco surgeon. But comparatively, if you look, see an obstetrician at the end of the day is surrounded by happy event. Most of the times, there is a joy of birth in a family. The people are happy, the relatives are happy, the doctor is happy. Most of the times, the scenario is like that. And when I look at a cancer surgeon, Dr. Abhinav is continuously surrounded with patients who are in various stages of cancers. So on a daily basis, you are dealing with them. So I think it must be taking some toll on the mental status. Definitely, it is going to be. So it's a stressful situation comparatively. So obviously, so how do you deal with this? How do you indulge in hobbies or something like which will be a respite in for you in this situation?
Ma'am, that is I think one of the most important questions as to how to manage stress. All of us are actually surrounded by stress, and psychologically, mentally, emotionally, it is a big turmoil, honestly. And daily dealing with people who are diagnosed with terrible disease, obviously, it also starts taking toll on your own self. Many a times introspectively also you feel, many a times you are scared, in fact, that oh, I also had such sort of a symptom yesterday only. I had pain in abdomen. So what if, what not, all these thoughts, they do cloud your mind. But uh, I think the best way is to kind of have a sort meditation, some sort of a physical activity, get yourself surrounded by your family and your friends. I think they are your biggest stress busters. uh, I know it is very difficult for us to have a switch on switch off button. And I really hope in future we ourselves as doctors do try to mold each other in the sense of a switch on switch off button. That means the moment we are out of hospital, we are out of our profession, for some time at least, we can kind of try to engage ourselves in a totally unrelated conversation. Maybe have a good time with your friends and your family. Your family, I feel, is the biggest stress buster. And whatever you can kind of share across, try to be more towards a playful attitude. Music, so these things, we are actually surrounded by that, but we hardly use it. I really would like to kind of encourage everybody to have these options as well, and these thoughts. Try to I know I myself may not be able to actually practice it on a very sincere note, but try to engage yourself in some non-professional situations, like music, like playing, having some outdoor activity, meeting your friends, going out with your family, have a small vacation in between. I think that is the need of the hour. Unfortunately, for us, everything starts and ends with our profession. Our day starts and ends with our profession. And I think over a period of time, if we want to keep ourselves going, we need to kind of detach ourselves for some time, try to rejuvenate from within, and then get back in a much better situation back. So all of us do realize that the moment we take a small break, be it a 3 or 4 days break, we go on a vacation with family, and we are and if there is no mobile phone network, so how peaceful we feel. So that is actually the need of the hour, that we need to kind of honestly practice. And on a day to day basis, things like yoga and meditation, I feel they are the best stress busters. At the same time, you can actually have time to introspect as to how you want to take your life further. So I really feel that we all need to encourage each other as a fraternity to have a peace of mind as well as a good physical health.
Very well said. And during day-to-day work, I think we should also have ready plan B, plan C. What do you think about it? Like
So, ma'am, plan
things
A,
may
B,
not
C.
go as we wish or as we have planned. So that could add to the more stress to our working pattern.
Yes, so in fact, I would like to put it across to even the youngsters and the young professionals, even the residents, that as we always have a plan A, that okay, I want to do this in my career, and this is the best option. We feel that this is the best option for us, and anything which is away from that may not be a good option for us. That is what our thought processes are. At the max, what we keep is that okay, if this thing does not work out, we may have a plan B. If I don't get this branch, okay, I may settle with another branch. But what I would like to really stress upon, that in case if both A and B does not work, there might be a plan C, which is already kept reserved for you. That is, as initially we had a discussion, that it is God's will. So your plan C actually might work to be better than plan A plus. So never get disheartened, especially in terms of your career focus. So I really feel that uh, always be ready, be more open to accept, rather than kind of frowning about something, that okay, you don't have this or you don't have that. As I mentioned, that the journey, nobody has a very smooth cakewalk journey. Everybody has their own share of problems. So how we basically try to tackle it, that is what defines us over a period of time. And plan A, plan B, absolutely fine, but plan C might be waiting for you, which might turn out to be better than plan A plus. So never get disheartened, there is something good in the store already kept for you. That is what we must firmly believe.
You have taken a different path, Abhinav. You have chosen a different branch. You are making a very good name into it. You are known as a very young and budding oncosurgeon, robotic surgeon. So, um, what is your advice to the young people who wants to choose something different to make a mark? What would you like to advise to them?
Right,
The
ma'am. So,
medical, especially.
for the young budding doctors, young budding surgeons, and gynecologists, see, I would genuinely advise that it is always good to have focus. That okay, I want to do this. That is good. And second point is, as I mentioned, plan ABC. Also keep that thing in mind. Most important in our profession, never compromise on ethics. Ethics and morals, I feel, they define you as a professional, they define your character. So I really feel that always consider that the person in front is going through a very horrible sort of a situation, and we need to kind of have that empathy, sympathy for the patient. At the same time, have a very ethical and a very practical approach. So that is how would define you in terms of your professional capacity and ability. And never compromise on ethics. That is what I would like to kind of stress upon for the youngsters. And always good to have great goals, and but have a very practical sort of a goal as well. uh, do not get disheartened if you don't get something which is very very impractical right from the beginning. So better is to have a better is to settle in terms of your thought processes. Be at peace with your own self. That is very very important. That, and do not try to have a comparison and a competition always. Or unfortunately, the competitive exams make us pretty competitive, but I really feel that we must keep that competitive spirit only up to those exams. They do not have any relevance later on, because everybody has their own set of story, and everybody has their own set of issues. So one single yardstick cannot be a comparison for every single doctor. So that is what I believe, that try to kind of make a peace with your own self. Try to settle for most realistic things, and try to be practical at the same time. Never ever compromise with your ethics and morals.
Aim high, but keep the aims practical and realistic.
Yes, yes, ma'am.
And ethics is most important. So it was such a lovely conversation with you, Dr.
Thank
Abhinav.
you, ma'am.
And
Thank you so much.
I must say, it was a very, a very wise pearls of wisdom you put. It was a great conversation with you. And I'm so much thankful for you because you joined in your busy schedule. I know today also a whole day you were busy in complicated surgeries. I know that. And it was lovely having you with us today. I'm especially thankful to our president, Dr. Sunita Madam, for giving us this platform so that we can interact with the great personalities like you, Abhinav. And I'm also thankful to Dr. Palaniappan sir because he has also taken time and joined with us today. And also special mention and thanks to our technical team of Gyan Pravah. Thank you very much. It was a great time and see you again sometime.
Thank you so much, ma'am.
Thank
Thank you so much.
Thanks.
Thank you, ma'am. Thank you.